Yesterday, COVID hospitalizations in Alabama hitting a new all-time high.
Hospitalizations up in Mobile as well. The numbers are well off the summertime peak.
Investigative reporter Brendan Kirby has been digging into those numbers. He now joins us live from the Mobile County Health Department. And Brendan, there is an explanation here.
Yeah, there's an explanation. We're not really sure exactly what it is because there's competing theories, but I guess we can just chalk this up to another coronavirus mystery. Hospitalizations have surged as the infection rate has escalated. Yesterday's report shows 2,165 COVID-19 patients in Alabama's hospitals. That's about 34% above the 1,613 patients on August 6th, when the state hit its previous peak. Hospital admissions have been rising in Mobile as well, but not nearly as fast. Yesterday, 115 people were in Mobile hospitals for COVID-19. That's actually slightly less than the beginning of the week and well below the record. That came on August 11th when 232 were hospitalized.
Mobile's interesting. Mobile, as you point out, really did reach very high numbers much earlier in the year. But the numbers got down. In fact, Mobile numbers in mid-September, you were down to 66 patients in hospital. Yesterday, you're back over, you still are over 100 now. You're about 115, I think, from yesterday in Mobile hospitals. And so there is increases, but it is not like the almost 500 cases we're seeing in Birmingham hospitals.
That was Dr. Don Williamson, president of the Alabama Hospital Association. He says the situation statewide is serious. There have never been more COVID-19 patients hospitalized. There have never been fewer available intensive care unit beds. The state currently has the second highest number of C-19 patients hooked up on ventilators. As for why Mobile hasn't been as hard hit as the current wave, Williamson says there has been geographic variation since the start of the pandemic.
It's a function of how much transmission is going on in the community. Now, whether Mobilians have followed mask orders better than some other places in the state, whether it simply represents a lag in spread of the virus, I don't think we know at this point. All we can say is that you are going up from a lower baseline. You're not back to your the highs, but you're going in the wrong direction.
We asked the Alabama Department of Public Health about this. Officials there referred us to the Mobile County Health Department. Mobile County epidemiologist Randy Murphy points to several factors. Area nursing homes are seeing fewer cases. Murphy says that there are people most likely to require hospitalization. She also speculates that more widely available testing is allowing people to know that they're sick sooner. She says the biggest factor may be personal responsibility.
It's only because of you that we're able to slow spread and protect those community members that might require hospitalization if they were to become infected with COVID.
And despite the surge in hospitalizations, we haven't seen the kind of widespread cancellation of elective surgeries like we saw in the spring. And Williamson says the reason for that is that there's less of a need in the hospitals to conserve personal protective equipment. Reporting live in Mobile, Brendan Kirby, Fox 10 News.